My name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with special concerns of women, starting with the letter O. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormone and the metabolism, and then issues of infection, infestation, and the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases of childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with special concerns of women, continuing with the letter O. Between puberty and menopause, a span of approximately 35 years, a woman ovulates about 400 times, normally at intervals of 28 days. If an egg is fertilized, pregnancy follows. If not, menstruation occurs as the vascular lining of the womb is shed. This cycle of fertility is maintained by 3 hormone-producing glands, the hypothalamus, pituitary, and ovaries. The ovaries produce 2 hormones, estrogen and progesterone, in response to 2 hormones produced by the pituitary, which are follicle-stimulating hormone, or FSH for short, and luteinizing hormone, LH for short. Estrogen levels responding to FSH levels rise dramatically in the 12 days leading up to ovulation and are at their lowest during menstruation. Levels of progesterone secreted in response to LH are highest after ovulation, preparing the lining of the uterus, the endometrium, for implantation of the egg. Menstrual bleeding begins approximately 2 days after estrogen and progesterone secretions reach their lowest levels. About 1.5 ounces of blood are then lost over 3 to 7 days. The uterus or womb is a thick-walled, pear-shaped organ about 3 inches long with a narrow neck or cervix at its lower end. The mouth of the cervix juts into the top of the vagina. Opening into the bulbous upper end of the uterus are 2 tubes about 4 inches long called the fallopian tubes. The fallopian tubes are lined with tiny waving hairs that transport eggs from the ovaries to the uterus. It is in one or the other fallopian tube that fertilization usually occurs. There is no direct connection between the ovaries and the fallopian tubes. Eggs are simply released into the fluid-filled peritoneal cavity and wafted towards the fringed entrance to the fallopian tubes. The ovaries themselves are almond-shaped and about 1.5 inches long. At birth, they contain many millions of immature eggs and follicles. But as already mentioned, only about 400 of them reach maturity. Although several eggs may begin to mature each month under the influence of FSH, however, usually only one egg totally matures. Once it's been released from its follicle, the follicle turns into a corpus luteum, literally yellow body, and proceeds to secrete large amounts of progesterone. The external female genitals, referred to as the vulva, consist of the fleshy inner and outer labia, or lips that conceal the entrance to the vagina, and the clitoris, which lies just above the urethral opening, where their inner labia meet. The clitoris is very sensitive and a focus for many of the sensations that trigger orgasm. The vagina is about 4 inches long, and it expands and lubricates during sexual arousal, and is most sensitive to near its entrance. It is protected for infection by populations of acid-producing bacteria. Breast development is one of the first signs of puberty in women. The breasts move with the pectoral muscles underneath, and their hang is greatly influenced by posture and the tone of the muscles that brace the shoulders back. Embedded in the fatty tissues of each breast are 15 to 20 clusters of milk-producing glands, whose ducts converge on the nipple. The pigmented area around the nipple, called the areola, contains glands that keep the nipple supple. Ovarian cysts. Ovarian cysts are fluid-filled outgrowths of tissue that develop on or near the ovaries, often symptomless unless large enough to press on bladder or cause visible swelling in the lower abdomen or pain after intercourse. If production of ovarian hormones is affected, menstrual cycles may become irregular, but this is rare. Risk of cancerous change is small. The greater risk being perionitis, which is a sudden severe abdominal pain, nausea, fever, abdominal distension that occurs if the cyst bursts. Where possible, especially in younger women, the cyst is removed without damaging the ovary. In other cases, removal of the ovary and fallopian tubes may be advised. Constitutional homeopathic treatment is usually required, but the remedies to follow may be of benefit. Specific remedies to be taken 4 times daily for up to 14 days. Left ovary affected, local pain that is worse in the morning but wears off during period. Use Lachesis 6C. Lower abdomen pain that feels like a wedge being driven through the ovary and womb. Use Iodum 6C. Right ovary affected, sore, stinging pains locally, painful periods with tenderness in the lower abdomen. Use Apis 6C. Small round cysts causing pain that seems to bore through the lower abdomen. Bending double and pressing fistins to the abdomen gives relief. Use Colocynth 6C. Ovulation pain. Ovulation occurs on average 12 to 14 days before the onset of menstruation, but it is an event of which many women are unaware, unless they practice natural conception. Some women, however, experience lower abdominal pain that is more localized and qualitatively different from period pain. If the homeopathic remedies that follow prove ineffective, see your doctor. If pain is part of a wider picture, constitutional treatment is recommended. Specific remedies to be taken every hour for up to 10 doses. Nervy pain, relieved by warmth, by bending double, or by pressing fists into the lower abdomen. Often worse on the left side and often associated with anger. Use Colocynth 6C. Violent cramping pains, worse on the left side. Ovary feels as if it's being dragged up towards the heart. Use Naja 6C. Right-sided pain, worse between 4 and 8 a.m. Constipation and wind, apprehensiveness. Use Lycopodium 6C. Right-sided pain that shoots up to the breasts, alleviated by pressure. The abdomen feels bloated. Use Palladium 6C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.